All right, Dr. Jane is back with us now. Taking a look at some of the questions that you are asking. If you are here, as a man in my 50s, are there rather certain tests that I should ask for in my annual blood panel? That's from Joe R, and it's a good question.
It is a great question. And the first thing that I want to say kind of is really the end of my advice on this is when your healthcare provider says, I'm going to do some blood tests or everything is normal, you should actually say, well, what are you actually testing? And can I have a copy of the results? You can't imagine how many times I'll ask someone, well, did you have any blood tests? And they say, yeah, and it was normal. And I said, well, what did you have done? And they don't know. It's that healthcare provider's job to tell you what they're looking for, but if they don't, you should ask. For a man in their 50s at average risk, and I have to underscore it, average risk, so that's no family history of anything significant, you should have your lipid panel checked, so your cholesterol. Most of the time that's done fasting, although it doesn't necessarily have to be. It can affect your triglycerides if you're not fasting. You should have a hemoglobin A1C to screen for pre-diabetes or type 2 diabetes. And then PSA, the prostate screening antigen, that's really individualized. For black men or men with a family history, they may want to start screening in their 40s, but that's frequently done in their 50s as well. And, you know, that's basically it. There are a lot of things that are unnecessarily added. But again, just ask. What are you looking for? What are you testing? Needle goes into your arm, blood's coming out. You should know what's being tested.
Yeah. But I want to test all the things. If you're already taking my blood, I want to know all the things you can get.
Out. One punch, huh?
Fair enough.
Your prescription for wellness.
All right, so some tips on how to manage the pain or discomfort that is associated with shingles outbreaks. This can be extremely painful because it's what we call neuropathic pain or pain coming from nerve endings. So applying a cold, damp washcloth just topically over that area can help. Soaking in an oatmeal bath can help superficially, as can, you know, some skin kind of lotions like calamine lotion. But also, unfortunately, there are a lot of people who develop something called PHN after a shingles outbreak that actually require prescription pain medication. That pain can persist for months, and it can be excruciating. If you're over 50, get that shingles vaccine.
That's the best advice.
Absolutely.
Thank you very much. And folks, we would love to hear from you. So hit us up on Instagram with all of your medical questions for America's favorite doctor at ABC GMA3.
Well, hey there, GMA fans. Robin Roberts here. Thanks for checking out our YouTube channel. Lots of great stuff here. So go on, click the subscribe button right over here to get more of awesome videos and content from GMA every day, anytime. We thank you for watching, and we'll see you in the morning on GMA.